The other thing I would love to hear you talk about, which was in that post that you and I were looking for, that then I think you'd taken down,
Oh yeah,
saying that you don't know, wasn't it, as a
yeah,
consultant?
yeah,
So I'd love to hear you just talk about that because you've said to me, saying I don't know really opens doors, I think
it
you
does. Yes,
tell me
and
about that.
I think as doctors, I'm not even going to go into the consultant role. Just as doctors, we we always have very high expectations of ourselves. I think we've done really well in school. We are the top of the top. We are the cream of the class. Then we get the best of marks to get into med school, and then through the med school again, we're trying our best to be on the top of everything.
Hmm.
I think over the course of those training years, you kind of build up that expectation that you as a doctor are supposed to know everything. The compulsion to answer every question, and then the guilt when you don't know an answer. And then from that, sometimes what stems out is you trying to justify what you've said, even if it's wrong or a bluff.
Wow,
It
that's
does happen. It
yeah.
does happen. It feels really difficult as a doctor to accept that there is a deficiency, we don't know something, there's a flaw, something that we've said was wrong.
Mm.
I think all doctors, including med students these days, the year five students, so everybody feels that urge to, know everything. I don't think that works like that. I don't think anybody in the world can know everything.
No, of
And,
course not.
and doctors are the people who really don't know anything. We work on reflexes. We work on patterns. So as a doctor, if I'm as a consultant in intensive care, suppose, if I'm looking after 30 patients, I can't, I mean, humanly, I can't be knowing everything about those 30 patients.
Mm.
I don't even remember the diagnosis of half of those patients unless I look at them on the bedside or go through their notes.
Yes.
So that whole expectation of doctors knowing everything is just so wrong. And I think it doesn't come from anybody else, it comes from ourselves. We expect a lot, we expect to be perfect, which I don't think works. So every time when I'm doing my ward rounds and there's something that I don't know, I just say it out loud and clear. If a junior asks me a question and I don't know the answer to it, I'm like, well, I don't know. What do you think? What do you know about it? Or why don't we go and read about it and come back and then speak up? So
Mm.
I just create an opportunity for them to go and dig out the answer themselves instead of me giving them some explanation which makes no sense.
Yeah, which is just off the top of
Which
your
is,
head.
yeah, and I think it's why I say it opens doors is because with my juniors, I think I give them that opportunity to go find the answers for yourself, which is how adult learning works. You're not supposed to spoon feed them. And if you don't know anything and you tell them clearly that you don't know it, I think they feel very good in themselves. It's
Yeah.
kind of a rush, a power rush or something that, even the consultant doesn't know this. So it's
Yeah.
it's okay for me to not know this. And I
Yeah.
think
Well,
it takes
that's
off
it.
that, yeah, I think it takes away that external pressure of, the compulsion of knowing everything.
Mm, mm.
So
Well,
I'm
it's
just
two things,
really,
isn't it? Because it's giving them the confidence to go and find it out for themselves. And of course, if you find something out for yourself, you're more likely to learn it anyway. And then it's also building that confidence to say I don't know further down the line because it's not a shameful thing to
yeah.
not know something. Is that's what you're modeling, which yeah. So do you notice a difference then when you treat students like that?
I do, yes. And so this was very recent. I was examining a med student, and after they've done their assessment, and we do a little feedback, and then we discuss about what they've learned and what they do differently next time. I was talking to her, and she was like, "Oh, I did this was nice, this was nice, and but I didn't know this, I didn't know that." She gave me five things that she did brilliantly, but then she listed 10 things that she thought she didn't know and she was supposed to know. And I was like, you were not supposed to know all of this. It's okay. Now you at least have the insight that these are the things that you need to go back and learn about. which is fine, which is what feedback's all about. So
Mm.
I was not expecting you to give me 15 etiologies for chest pain. No, I wanted to see if you can examine the patient, tell me what kind of chest pain they have, and then just roughly give me a provisional diagnosis of what you think it could be. And then from there, we can filter out more things through history. And then from there, we can then filter out 2 or 3 things that we think it is.
Mm-hmm.
When you come to ICU, you sometimes there are patients who've got asepsis of unknown origin, for example. You do 50 million tests on them, you'd still not find the cause for it. They will still go in a multi-organ failure and they will still die. But that doesn't mean that you didn't know anything. You did a lot of things on them. That doesn't mean you were supposed to know what diagnosis they had.
Mm.
It's fine. Sometimes you just work on assumptions,
Yeah.
presumptions. You can't be perfect all the time, is what.
Yeah, but that's so powerful to hear that, because you can understand why, especially if someone goes into organ
Yeah.
failure and
And
dies, why
this,
somebody would think, oh, that's my fault for not knowing.
yeah. And I think med students, I don't know how med schools work here. I've never been to one, but I think the way they are assessed in the med schools or in their exams or something about it, um, they just get fed this idea that they are supposed to know everything and go by the book
Mm.
about doing an examination. I don't ask them to do a by the book examination on the patients.
Mm-hmm.
Unlike you, I'm standing here. You just forget that I'm here. You go do with this patient as you would want to do. And then I'll just observe. I'll not say a word. Whatever you wish to do with him, you go do it. And then they do a lot of things. And then they're like, when they come back with the feedback, they will again keep on moaning about the same thing. Oh, I think I was a little bit less systematic, but you were okay. But you still,
Yes.
got your provisional diagnosis. You were a good history taker. That's all it needs.
Mm.
Because
So
there'll
there's
be
a
people
real
who help and
focus,
support you.
real focus for people on what they're getting wrong. They're focusing on what they're getting wrong. You're not necessarily focusing on it, but they're doing lots right, and then their whole attention's going on what's
So I
wrong.
think we as an educator or as somebody who's kind of in a supervisory position, I'd want to tell them like really clearly that we are not expecting you to know everything.
Mm.
You will never know everything. But if you've got the insight that you don't know something, that is the starting point of then gaining more knowledge and learning better. I think that's the starting point. When you
Absolutely.
accept the idea that you don't know it, that's fine. Over the course of those 2, 3 years, initially as an SHO and then as a registrar, I realized that there are people who know much better than me and who can help me gain that knowledge. The only way to do that is to go and ask them.
Yeah. It's
If
the
I
bit you
sit
don't know.
quietly, cooped up in the doctor's office, thinking that I can figure out everything on my own as an SHO, then that's the worst I can do for myself. I have to step out, ask anybody and everybody who's available, and try to get answers to all these questions that are bugging me.
Mm.
And I was pleasantly surprised that the nurses in ICU were so brilliant. They would answer all of my queries. I hardly ever had to go to a senior person or a consultant to ask those things. The nurses were brilliant. They would know everything.
Well, and they were
I was
probably
like, "Who
delighted to
to
be
ask?"
asked, to be recognized as
Yeah.
knowing so
The
much.
only thing they ask of you is you recognize them as your teammate and not your subordinate, not somebody who's working, below you. If you're just, I have made more nursing friends than I've made doctor friends. And I'm still in touch with most of my nursing friends, although I've lost touch with many of my doctor friends.
Mm.
You just go and ask for help. Why are you afraid?
Yes.
If Why are we afraid of telling people that we don't know something? It's probably because we are afraid of being judged. But even if you know everything, you will still be judged. It's a
That's
human
what's right.
tendency. Even
Yeah.
when you know everything, you will be judged for other stupid things. When you know
Yes.
nothing, you will be judged for being stupid. But either ways, somebody will find a reason to judge you.
Yeah. Someone will judge you for thinking you know it all if you know it all.
Exactly. it's never pleasant. People will judge you. So if they're going to judge you anyway, then
But
what's
is
the
it really
difference?
just about being judged, as in feeling judged, or is it going back to what we were saying earlier, also about um, impact on your career that people are afraid of? It's like, well, if I ask a question, then I look like I don't know enough, and that actually means something that I'm not where I should be. You know, like the student you were talking about, I don't know what I should know, and therefore that's actually realistically a bad thing. Therefore, I must just keep it quiet. And it sounds like that's just inaccurate.
It is. And I think the onus of that falls on the supervisors, the bosses, the leaders, or whoever is in a senior position. I think we are privileged to be in that position where we can change the whole narrative of this thing. We can make them. So I was learning about psychological safety at work. I think that perfectly fits in this situation,
Yes.
because unless you can make your juniors feel like you are not going to blame them for not knowing, unless you can make them feel comfortable enough to open up to you, you will never know, and
Mm-hmm.
they will never change.
Yeah.
So it's not just them. It's a dialogue. It's
Yeah.
not going to be one-sided. If we are expecting our juniors to be bold enough and courageous enough to come and, raise concerns in front of us, we have to give them the courage. You
Yes.
can't just be doing your mandatory training on things, and you know about the freedom to speak up guardian and things, and you tell it to your juniors during their induction.
Mm-hmm.
But why not be that guardian for them? Why
Yeah.
do they have to go to a third person to raise any concern?
Mm-hmm.
You be available for them. You let them know that it's okay. These are just two very tiny little words. It's okay.
Mm.
But we don't use it enough.
Yes. Yeah.
We are very quick in finding faults with people. We are very quick in telling them off for things that they've done wrong. But we're not quick enough to appreciate them. We're
Mm.
never quick enough to thank them. I've not seen, so I've got many colleagues who don't thank their juniors enough. And sometimes I need to push them to thank them.